Welcome to the Low-Carb MD podcast. No one is beyond help. No one is beyond hope.
As we have always said, we are bringing you medical information and cutting-edge science, but none of this is medical advice. Please seek out input from your own doctor.
Guys, welcome to the Low Carb MD podcast. Brian's going to really upset that he missed this one. I have a special guest with me. Actually, if you've come to our groups on Tuesdays, you already know her. Today we have, you may have seen her before. You may have heard from her before on other podcasts. We won't name where she's been a secret podcaster before. But I hear she's been on other low carb podcasts. Today we have Alice Smith with us. Alice Smith is a certified health coach. She is also a certified personal trainer. She has a bachelor's in kinesiology from Michigan State. She's coached varsity football. She is actually lowering her standards so far that she's joining this practice. She's joined this practice in New York. Well, actually, they're in 50 states, called Dr. Tro's Medical Weight Loss. So I am just excited to have you on here and interview you. I know your story. I can't wait till our listeners hear your story. I think the most important thing about your story to me is your vulnerability that you've expressed in other places, how you've conquered a sort of 60-pound weight gain, and how you conquered, how you really just improved not only your metabolic health, but your mental health. It brought me to tears, at our Tuesday group when, certainly it was nice to see your family there, including your dad and mom who we got to meet. Sort of talk about that journey you guys all had together and how you reversed, along with your mom, not only your own disease, but your family's disease. And I'm just excited to hear it all again and sort of go into some more. So welcome.
Thank you. Thank you for having me.
Yeah, absolutely. No, I got to thank you for lowering your standards and joining us crazy.
I wouldn't put it that way. I don't think my standards have, no, trust me.
Yeah.
I'm honored to work here and to be a part of this, reversing type 2 diabetes and obesity.
Yeah, it's funny. I was at a meeting yesterday, and we're talking about the burden of disease. And we're talking about the burden of disease and that this issue, diabetes and chronic disease, it's just such an immense financial, physical, and emotional toll on the population, on our families, on the people we care about, on our coworkers, on just people at our churches and our community centers. It is just a toll, and the toll of chronic disease is just worsened. It's just worsened. And when we first met, it was so clear to me that you were invested in health from like a young age. I mean, you went to school, you got a degree in kinesiology. You got out and you started coaching young men, and then you joined as a health coach to a health coaching company. And I mean, it was so clear that your mission to me was I just want to be in the space that gets people healthy, moving, happy, right? And then along the way, and you've shared this, you found that you weren't exactly doing what you intended on doing.
Exactly.
Can you just walk me through, what was Alice's primordial ooze? Like, where did she sort of come from? How did she end up going to Michigan State, getting a degree in kinesiology? What made her become a health coach? And then what happened next?
Well, and she's totally cool with me sharing this. I have asked previously, so no worries, but One of my earliest memories, and I think I've told you this, is when I was young, I was about 4. My mom had gestational diabetes with my brother while she was pregnant with my brother. And I remember walking into her bathroom and seeing her give herself insulin injections. And I remember thinking, like, it didn't make sense to me. I didn't understand. I was 4. Like, I didn't really understand it at the time. But as I got older and as her gestational diabetes went away when she delivered my brother, but then she went on to develop type 2 diabetes. And I just saw the toll, like you're talking, that took on her, and I wanted to help, but I didn't know how. And at that time, and what I had been taught in school, like when I had gone to Michigan State, diabetes was not a reversible condition. It was not something that we could, change. And I remember my mom saying to me, and my grandma had told her this, that, you get diagnosed with diabetes, you've got it for the rest of your life. And it was just this daunting and depressing diagnosis. At least that's how she's described it to me. And so I went to college. I went to high school. I went to a small Catholic high school. Went to college. I knew I wanted to go to Michigan State. My dad went to state, and big Michigan State fan. Don't tell Amy. But I knew that I didn't know what I wanted to do, but I knew I wanted to help in some way. I wanted to do something that I'm the oldest of, I'm the oldest child. I have 3 younger brothers, and I've always been like the mother hen, and I wanted to help. I wanted to do something. And I didn't get into nursing school. It was a very, very strict program at state. They only accepted like 7 or 8 students every semester, and I didn't make the cut. So I stumbled upon kinesiology, and I thought, I didn't have any other options, so why not? And I quickly learned that I was learning all of the things that I was fascinated by. I was learning anatomy, I was learning physiology, psychology, biomechanics, all of these topics that really, really interested me. Not a lot of nutrition, mind you, but what I had learned was, the calorie in, calorie out model. So that's what I kind of lived by. And I fully admit that I did, Weight Watchers. I've done different companies myself, and I've told my friends and my family about them, because that's what I thought at the time was the way to go. So after college, like you said, I had the opportunity to work with varsity JV football players at a couple of high schools downstate, as well as a couple other teams. So I worked with the cheerleading team, I worked with the basketball teams. But my bread and butter, low carb, of course, but what I really liked was football. I'm a big football fan at heart. I love football. I loved working with these kids. And they started calling me like their gym mom. I was not that much older than them, let's be honest, but I was the lady in the strength room in the gym who was telling them what to do. And it very quickly went from, oh, we don't want to work out, to realizing why it was so important. So moving forward, I got married, we moved. I don't know if you want my whole freaking story right now.
No, I want it. You know what? I want to hear more about the gym mom, but I want to hear the whole story first. Go ahead.
Okay, so we moved down to Ohio, and I got a job working at a gym, a facility, and this gym specialized in both youth training and sports training, as well as adults. So we worked with a lot of people of different ages. And personal training was something that I had experience with, so why not continue with it? And I really enjoyed it. I liked seeing the results that people had. But then we moved back to Michigan. My husband's job brought us back home, which is fantastic. And I didn't have a gym anywhere near where we moved. So I started working from home for a different company. And when I first started, I thought, this is great. I'm doing I'm still helping people. I'm, working in my field. I didn't want my degree to just get dusty on the shelf. I wanted to use it. And so I started working there. Had my first child. He is 3 now. And then when he was when he was like 9 or 10 months old, I got pregnant with twins. That pregnancy was very scary. They were very worried that we had twin-to-twin transfusion syndrome. And at 11 weeks, I was sitting there in the maternal fetal medicine doctor's office with my mom because my husband had to work. And the doctor said that you have a 60 to 70% chance of loss of both of your babies. And I didn't know what to do. All I knew was I was not happy. I was scared. I sunk into this like anxious depression state because I couldn't tell anyone about the pregnancy. And, I didn't want to have to explain later if something bad happened. I was a mess, and I ended up on bed rest. Thank God for my mom. She really came through and helped throughout that pregnancy because I also had a toddler. And all the while I'm continuing to work for this company. Fast forward, I'm sorry, you're getting the Cliff Notes version. Fast forward.
I'm taking notes. I'm on things to discuss. So.
Okay.
Yeah.
They were born at 34 weeks. We live in northern Michigan, so we don't have a NICU near us. So they were born, and their little lungs needed a lot of help. And it was an emergency C-section. They were taken from me and taken 3 hours away to a NICU. But I had just had a major surgery and I couldn't go. So it was a couple days later that my husband and I were able to join them, and they were in the NICU for a little over a month. They did great. They're awesome. They're almost 2 now, and they're, my world. But after that NICU stay and after that emergency C-section, as well as the trauma of the pregnancy, I was really not in a good place. And I was struggling tremendously with postpartum anxiety and postpartum depression. I was detached. I had a hard time. A really hard time. And what I turned to was food. I put on quite a bit of weight, and I didn't feel like myself. I looked in the mirror. I didn't know who I was. I just wanted to crawl under the covers and stay there. But I had 3 little kids who needed me. So that wasn't an option. So I just ate. And I tried to hide it from everyone. I hid it from my parents. I hid it from my husband while he was at work. I didn't know who to reach out to or what to do. And it took quite a bit of time before I realized that I needed to get better so I could be a good mom, a good wife, a good friend, a good daughter, a good sister, everything. And so I ended up trying to lose the weight, and everything that I had been taught to do wasn't working. So I started off with Weight Watchers, and I got my mom to do it with me because, we're like 2 peas in a pod that way. We do things together. And I lost a little bit, not much. I started exercising all the time. I did other programs, and nothing was working. And then I found my good pal, Vinny Tortorich. I found him, and I found NSNG. And as Amy says, low carb is not an easy way to lose weight, but it was the easiest way that I had tried. And I was able to lose the weight. But in that, realized that what I was doing for my job was not in line with what I knew had worked for me and for my family. So I started looking around, and
Hold on. Let's stop. Can we pause here? Do you mind if we pause here? I'm sorry.
Absolutely.
Everybody hates me for interrupting, but so first of all, thanks for being so vulnerable and sort of talking about that. Postpartum depression is like this, big taboo, and a lot of people don't talk about it. And your vulnerability, I'm sure, will give courage to people listening. It's significant. Postpartum depression affects. It could be up to 1/3 of pregnancies. And the worst part about it is sort of people feel sad for feeling sad. Mm-hmm. You're like, why do I feel sad? And it can be sort of a spiral. And it's significant a significant morbidity, really morbidity, and a quality of life issue. But it sounds like you had such an amazing support system. You've talked about your mom being like a support for you, and two peas in a pod for you, and maybe some time and the settle after your kids sort of getting out of the NICU and settling down. And but it's so clear. It sounds like your weight gain was both that maybe an element of that genetic sort of predisposition. Mom had insulin resistance in pregnancy. Mom had sort of insulin resistance, and here you are maybe experiencing that, and then culminating with this sort of a depressive episode that just that pleasure and deficiency in depression, that anhedonia, we call it. Like, we try to self-treat. Most people try to sort of self-treat, and the easiest way to treat is to sort of if it's not food, it's alcohol. If it's not alcohol, it's something worse. So here you are, sort of in this spiral, but there's like a resiliency about you, because you're going to the worst of the worst, calorie counting, Weight Watchers, and you're not giving up. So walk me through what that not giving up sort of looks like and feels like. Because I'd imagine it was very a vulnerable time for you.
Yeah, for sure. And just to go back on what you just said, I was told that my twins probably weren't going to make it, right? So I got through that. They were here, and here I am feeling sad, and I'm dealing with all these hormones when I should be overjoyed that they're here. It was like this mind trip of why do I not feel how I should feel in my mind? Like, what's wrong with me? But I was
such a head trip too. That's a big head trip, because there's nothing wrong with you. You have every right to feel, like you just had an emotional whirlwind, right? And man, it's a lot to process all at once. I'm trying to put myself, and I can't even do it. Put yourself in your shoes.
And it was, so when I had preeclampsia, and I look at everything I know now. I look at, low carb. I look at how metabolically unhealthy I was. I was drinking Ensure, 3 to 4 Ensure, those like drinks, every day.
Soybean oil and high fructose corn syrup.
Yep. And I was drinking that because I read on a twin-to-twin transfusion blog that I was susceptible to proteinemia. So in order to deal with that, because I was so sick, I was drinking these high protein drinks that were probably terrible for me, but I didn't know any better. And I remember I had preeclampsia with my first, but then I had severe preeclampsia, like the magnesium drip, the whole 9 yards with the twins. And
can we tell people a little bit about preeclampsia?
Yeah, absolutely.
So preeclampsia, just for the listener who's sort of interested, preeclampsia is a condition that eclampsia and preeclampsia severe, all of these ultimately can culminate in something called HELP syndrome. It's a sort of the spectrum. It's highly associated with having hypertension before pregnancy, associated with insulin resistance before pregnancy. It's a complication of pregnancy that involves the nervous system. A lot of times when you sort of sit these pregnant patients down and you do some reflexes, they have very brisk reflexes, and they can have liver injury that gets involved. And the treatment, sometimes can be magnesium drip, which is very common in the ICU setting, managing the blood pressure. And sometimes you have to get emergency sort of surgery because of it, because it presents a danger to the babies. It's scary. It's a scary time. So you had this twice, basically.
So I had this twice, and so I was 34 weeks. And I was getting these injections. You'd probably know the name of it. I can't remember, but they were 2 injections 24 hours apart to help develop the baby's lungs.
Yeah, it's a steroid. Yeah, usually they give a steroid to help help them out?
So I had the one injection, and I went home, and my husband was working, but my mom was staying with us because of our son. And I looked at her and I'm like, there's something wrong with me. And I was feeling this numbness and this tingling, and it was going all the way up my body. Like at one point I was sitting on the couch and it was like my chest was tight, and then this numbness all the way up my neck. And I said, I bet you it's just the steroid. I might have an allergic, like, I don't know. I'll be fine. I'm going to go to bed. The next day I had to go in to get the second injection, and I walked in and the nurses were all at the station. I said, there's something wrong. I don't know if I can do this second dose. She goes, what's wrong? I said, I don't feel good. And they put me down. They did my reflexes. My leg flew off the table, and my blood pressure was like 220 over. I mean, I was stroke range. It was bad. And they called the OB, and she came right over and she said, we're going to surgery. My husband was at work. My mom had gone home that day, which is an hour and a half away. I called her. She was pulled into the driveway. I said, the babies are coming. I need you to come back and watch Theo. And she did. But it was terrifying. So that was that. Yeah.
I mean, it is quite terrifying. It can be quite dangerous, both to mom and baby. Interestingly, there's a lot of theories going on that it's simply a manifestation of metabolic syndrome and hyperinsulinemia. So here you are, and you sort of go into, you're working. Let's go through sort of your own life. You have a huge desire to help other people. You train. You're the gym mom, which we got to go into at some point. You're training a bunch of young men who need that sort of, who need the mentorship. Man, our young men in our society. I know you having, sons. You recognize that, and you went to school to help people, and you're working in a gym and sort of helping people. And here you are in the most desperate sort of time. How did the system help you? You're depressed, you're anxious, you have not your family. How did the healthcare system help you? Here you are, preeclampsia, probably due to insulin resistance, right?
Right.
How are you helped?
Well, I didn't have a lot of help from my maternal fetal medicine doctor. In fact, she wanted me to go a different direction with my pregnancy. I have a wonderful OB, but the problem with our system in the United States, if you want to get there, is moms are seen 6 weeks after the babies are born, and that's it. So 6 weeks, we were still in the NICU. We hadn't been home yet. So when I got home, I went and saw her, and she checked my incision, but there wasn't a lot of like mental health screening or anything. I didn't really have a great doctor at the time. She was okay, but she didn't know a lot about postpartum depression and anxiety. And honestly, either did I, and I was too proud to ask for help. But I sat down with one of my friends and I said, I don't know what to do. I'm not okay. And she said, maybe you need to get on something. So I went to the doctor, and that was the first thing that happened.
So here you are, probably with insulin resistance and metabolic syndrome beforehand, which we know increases the risk of eclampsia, preeclampsia. To make matters worse, we know sort of from mom's history of gestational diabetes of what to expect in you, right? So, I mean, not to play backseat driver, but somebody could have looked at this and said, these are the things we have to do. Like we could have, this is backseat medical driving, so to speak, but this could have been prevented. Right? This could have literally been prevented. And now you're left in poor metabolic health, which leads to an incredibly traumatic event. And, that poor metabolic health, right? The soybean oil and the high fructose corn syrup, it's not, it's not unimaginable that somebody's mental health would decline, particularly in a state where you're so nutritionally depleted, postpartum. And so here you are in the worst possible metabolic health of your life, probably to date, and the worst possible mental health. And maybe this could have all been prevented. And to make matters worse, nobody really cared.
No.
And imagine you didn't have a family support system and you weren't so resilient.
Oh, I cannot even go there, because that's a terrifying thought to me. Like, if I didn't have such an amazing husband, who, like, my husband is incredible, and he picked up on it, and he's like, but at the same time, guys are very, a lot of times men don't necessarily understand the hormones that we go through after birth. And we can be very short and, Well,
that and just postpartum, men, look, men will never, oh my God, I should be careful with how I say this. Men will never experience, biologic genetic men will never experience, biologic genetic men will never experience postpartum depression. I'm not talking about identifying with being male. I'm talking about biologic genetic men, right, will never experience it. So not only can they'll never experience it, but mental health alone is something very difficult to relate to, let alone, just your average sort of, spouse or loved one.
And just to add a little cherry on the top, we had twins who never slept. So we were never sleeping. It was a recipe for disaster.
But I mean, good on him. So he's supporting you, mom's supporting you, and you're a fighter, and then you fight and you sort of conquer the mental health. And then at some point you're like, let me focus on my weight, which is really like you saying, I need to fix my metabolic health. I mean, we just don't perceive it that way.
Right.
And you're trying everything. Weight Watchers is happy to take your money, I'm sure. The Nutrisystem or whatever, they're very happy to take your money. And then ultimately you sort of, you went down a rabbit hole you couldn't come back from.
Yep.
And so what happens next?
Well, I spent a lot of money, Tro, on the Weight Watchers food. In fact, I was looking at on your phone, you can look at your past subscriptions, and it's interesting when you look back and it's like Weight Watchers expired, whenever. And like all of these subscriptions that I used to have because I was so desperate. I tried everything, the hydroxycut, the, you name it, the Goli or whatever, apple cider gummies, the whatever you can think of, I tried. And it was the only thing losing was my bank account, because I was not losing much weight. I mean, I was losing a little, like water weight, but it would just come back. And from my educational standpoint, I didn't know why. Why wasn't it working? Is it because I'm, pumping? Because I pumped for my babies. Is that why I can't lose any weight? Is it because I'm not exercising enough? Is it stress? Is it I could probably come up with a justification to blame it on myself. And we talk about this with our patients all the time, this obesity cycle, this obesity trap. I was so stuck, and I was so blaming myself for everything that had been, thrown at me. But after I found low carb through Vinny, I was able to
shout out to Vinny Tortorich, just real quick. I don't think there's another, there's a couple of non-doctors who've probably reversed more disease. Nina Teicholz is one of them. If you guys are listening and you haven't gotten her book, you haven't read her book, go read her book, Big Fat Surprise. Go support her Substack. She's the former executive director of Nutrition Coalition. Go donate your money. Vinny Tortorich is another one of those people. Vinny is the angriest personal trainer that you'll ever meet. And he's the director of several documentaries, including Fat. Um, and he's got a podcast that Fitness Confidential. And these two people have probably reversed more disease than most doctors I know.
Yes.
Doctors I know. So shout out to both of them. So you found Vinny, and Vinny cures your metabolic syndrome, right? So how did you go from I'm a bachelor's in science of kinesiology and a trainer and energy balance is the reason for obesity to holy crap, I'm mistaken?
Well, Vinny and I have very similar backgrounds. We both have degrees in kin. We both are trainers. So like, I felt like there was some commonality there, and I'm like, well, if this guy's preaching this, but I also have to give another shout out to Dr. Jason Fung, because he was also a big part of my journey. My mom read the diabetes code, saw herself in the pages of the diabetes code, and I read it. And then we started fasting together, which, as you know, fasting is like something that I'm very passionate about. But between that and then just seeing the results, like, oh my goodness, things are moving. Oh my goodness, I can think clearly for the first time in months. Oh my goodness, my anxiety levels are not making me want to claw someone's eyes out and, freak out whenever the phone rings. I'm not getting, when the kids are crying and the TV's on and everything's going on, the laundry machine goes off, I'm not getting overwhelmed. This is like a magic pill, and it's free. That was the biggest thing for me. I'm like, at that time, he didn't charge for his PDF, and I downloaded it. My husband and I sat down, and my husband decided, I'm going to do this with you. So he as well. So between my mom, my dad, my husband, we all did it together. And between the four of us, I think we've lost over 250 pounds total.
That's amazing.
But all through, and we didn't spend a dime. So that was pretty cool.
That's another shout out to Jason Fung. He helped us sort of really kickstart this podcast, and all the work that he's done. It's just been he's just been such an inspiration and a mentor to me as well. And the amount of people, you go to conferences and all you hear is what an impact he's had. So you go down this rabbit hole, reading Jason Fung, your mom's doing it, your family's doing it, your husband's doing it. You guys have lost 400 pounds collectively, and you're working for generic health coaching company, which we're not going to name by name, basically not really helping people, right? So the generic health coaching company, which we're not going to name by name, how do you reconcile? It must feel like torture.
Yes, and yes. I felt like I was doing such a disservice. I felt very conflicted, but I had to help with the bills. Like, what else am I going to do? So I just made the decision, I'm going to utilize this generic health coaching company for whatever I can. So I ended up taking my MBHWC course. I ended up just really trying to hone in on my coaching skills, in hoping, praying that another opportunity that would better align with my values would come up. And I had many conversations with my good pal, Vinny Tordrich, about what to do. I'm like, do you know of anywhere that I could look? Like, I know Verta, but they're not currently hiring. He said, my buddy Tro, he has health coaches. Why don't you reach out to them? And I was like, okay. So
he put you through this torture?
What?
So he put you through this torture, huh?
Yeah, you keep saying torture, but really it's been pretty great. So yeah.
Okay, so I'm just curious. So you're coming from generic, unspecified, largely defunct health coaching company, okay, that actually is having minimal impact on anybody. And you come, you talk with Amy, you talk with maybe Talene, our office manager, Amy Igus, our program director, and we start talking. And what do you think? What are your first thoughts? You probably heard our podcast and probably heard Amy talk and stuff. So what are your thoughts like about this before you ever sort of came full steam?
Well, I had listened to this podcast. I had listened to you and Rosette on Vinny's podcast. I'd listened to Amy and Brian as well. And the biggest thing that stood out to me was that everyone has been there. You all have walked the walk. You've struggled. You've lost the weight. You've maintained it. I mean, what? Brian's maintained his weight loss for 10 years, 11 years?
15
Okay, 15 years. 15 years.
15. He's an Atkins OG.
Yeah. And I mean, Amy's lost such a significant amount of weight, and you want like it from my outside looking in perspective, this practice wanted to pay it forward because everyone knew what it felt like to be stuck in that obesity trap and then how to get out. And it seemed like the passion behind it was to help other people get out. And that aligned with what I wanted to do. That was where I wanted to go. And honestly, it took a while to get things moving. And I actually had other prospects. I had interviews with Verda. But it came down to, I think I could really make a difference here. So.
Oh man, you left Verda for us? Jeez.
I didn't leave them. I just did an interview with them.
That was a dumb move. No, I'm just kidding. Look, we call ourselves the East Coast Baby Verda. So we're the East Coast Baby Verda. Look, we're so happy to have you. I got to be honest. When we first met you, we were just, so excited. And, immediately, between your help on and your expertise sort of from generic health coaching company and your expertise in fitness has really been such a help. All of our patients are basically now getting an assessment by you. People are raving about you. They're getting specific help. Once they've sort of lost weight or when they're interested in exercise, now they have a path within our office to sort of get started, not only get started, but then also progress. We have so many people just excited to work with you. I hear you're really busy taking on a bunch of new patients this past couple of weeks, which is awesome. You've written some just amazing blog posts, and you're running a no lunch fasting support group.
Yes.
Which has been really appreciated by some people who are really looking to leverage fast and feb. But ultimately, I think we're just happy to have you come on. We're so excited to see what happens next.
Well, thank you. I am very, very happy to be here. And I said to my husband the other day, he's like, how's it going? And I'm like, I really like it. And I haven't been able to say that for a really long time. So thank you.
Yeah, I mean, look, we our mission is clear. We want to have a real impact, right? It's funny. Ultimately, like I'm selfish, right? I want to know that I'm having an impact. If I'm not going to have an impact, what the hell am I doing? And being a part of a team that has a laser focused mission on really addressing diabetes, obesity, hypertension, metabolic syndrome, like these are such a huge impact on our families and our loved ones. Look at your family, look at my family. Mm-hmm. And mental health is so intertwined with that. And so, can we tackle this? Can we give people hope, a community, a plan, a progression? These are so critical. And you've already just some of the stuff you've developed, like, we have at least one, get started sort of plan on our app now for our patients, where they can just get started with bands, get started with body weight, get started with, if you're just getting started in the gym, what do you do? And we sort of have these outlines that you've put together, which just make it easy for people. And then, what do you do if you have, something more specific? And these are the tools that people need. How do we exercise around an injury? Here I am, we've talked about my back injury. I had a terrible accident 3 years ago, required spinal surgery in my neck. I've had chronic lower back pain, and how do I progress in a way, that doesn't hurt my back? Mm-hmm. These are things that often need a whole team. And the fact that you can come to me and say, hey, I got this guy with lower back pain, what do you think? And the fact that I can go back to you like, hey, Alice, I'm sending you somebody, be careful of his lower back, and we can customize their plan. So all they have to worry about is doing what they want to do, which is get healthy.
Well, and not just that. I mean, that's huge. That part of our practice is huge. But one thing that I really, really like that we do, and I think we do well, is, you have your personal trainer, you go to the gym, you work out. All right, see you next week. That doesn't help with the hard moments that happen during the weekend. You go out to dinner. You don't want to get out of bed and go to the gym. I think what we do really well is we are there for our clients and for our patients constantly. My favorite thing is to get a message from a patient saying, hey, I need some help. And I'm right there. And I love that we have that, capability. That's something that I've never had access to before. And when I was on my journey to lose the weight, if I had had that, I can only imagine what it would have done for me. So
look, part of being an exceptional medical team is being accessible, right? There are finite times when people need you. There's maybe 5 times a year where somebody needs an amazing doctor, an amazing medical team, amazing coach, an amazing trainer. When they want to create that plan, their vision, when they want to get that wellness sort of plan get in place, when they want to follow up on their execution of that plan, the labs, an assessment, a review of their body composition, a review, whatever it is, what they've achieved and sort of their progressive overload when they're working out. So when they're sick and they're ill, or when they're weak, desperate, and just ready to give up, right? When they've lost hope and they need motivation and support, when they're depressed and reflexes are going through the roof, mm-hmm. Right? They needed support. And not only do they need support in that moment of not weakness, but there's just that's such a pivotal moment. If a doctor came to you in that moment when you were depressed, hyperreflexive, metabolic, with metabolic syndrome, preeclampsia, and said, Alice, we're going to help you right now, and we're going to make sure you get better and better. And these are the things you're going to face, and we're going to face them together, and we're going to walk you through. So you're going to walk out the other side. You may have depression. You may have feelings that you can't control. It's a lot of this is related to sort of what your family gave you before you were even born, right? A lot of this is related to the diet we've been exposed to and the high fructose, soybean oil shakes and the, metabolic syndrome and insulin resistance you had beforehand, but we can address it. If in that moment of weakness you had a team in place, how valuable would that have been to you? How much would you have paid for that moment?
Oh my goodness. I would have felt like I can do this.
Yeah. How much is that worth to you? Like this is the thing, not to make it a money thing, but this is medicine. This is what people need, real value. And the fact that you love being a part of that value, That's what we need. We need people who are inspired to be the team they needed in their most darkest moments.
Mhm.
We're excited to have you. I got to do a segue here.
Okay.
I got to do a segue. Talk to me about you being a role model to these young. So let's go back. I want to hear about Gym Mom. All right. We
Oh
told
my gosh.
you about
Okay.
Legway. Okay. So tell me about Gym Mom, because I mean, again, you know, being a mentor, a friend, and a leader, it sounds like it's in your blood, you know? So what is it like being Gym Mom?
So keep in like the high schools that I was working at, they were in low income communities, and the schools prior to hiring us had never had a strength and conditioning coach work with their teams. These schools were small. So on the varsity football team, we had 24 athletes. So these kids were playing multiple positions, and the team really could not afford for people to get injured. From what I had learned in my training with Spartan Performance, was neck training, reducing risk of concussions, making sure that I was making them as strong as I could, so that when they got on the field, I didn't care if they could hit someone harder. I cared that they could withstand a fall or withstand, you know, getting knocked to the ground with a 300-pound kid and like make it to the next game. That's what I cared about. But you're dealing with hormonal 16 through 18-year-olds who just want to hang out with their girlfriends by the lockers. So you have to find this balance of hard ass and, you know, compassionate, kind, I'm here for you. And I was able to toe that line pretty well, I'd say. At the end of the season, the quarterback, he's just this super nice kid, but his dad was one of the coaches, and he was very, I don't know the right word, but he came up to me and he gave me a hug and he said, "Thanks, Mom." And I said, "Excuse me?" He goes, "I feel like I really appreciate you." And for a kid who's 17 years old to say that to me, that meant a lot. These kids were giving me their senior pictures with a note on the back saying, "You changed my life." I mean, bringing tears to my eyes of they didn't have anyone. And you know what? Sometimes, you know, this girl who was on the cheer team, she broke up with her boyfriend and she just came into the weight room sobbing. Sometimes you just need someone to listen. Sometimes you just need someone to care, because a lot of these kids go home and they don't have someone who cares. They don't have someone who says, "Tell me about your day." They have to make their own dinner, put themselves to bed, get up in the morning and do it all over again. And so I was fortunate enough to not have that when I was growing up. I was fortunate enough to have a stable home environment. And if I could be what made these kids want to come into the weight room and want to, you know, work out, but want to just keep going another day, another week, then that's what my job was. So I took that very seriously, and I still keep in contact with a lot of those kids who are not kids anymore. But it was very important to me. And now, having boys myself, I know how important it is to create that and to be that for, you know, for others. So
I have two boys and a girl, and you know, I say this a lot. I've said it on the podcast. You know, sometimes our men need support. You know, if you look at men, just as a sort of you know, men live on average 6 to 10 years younger than women. They die 6 to 10 years before. They're 4 times more likely to abuse alcohol or drugs. 92% of the people in prison are men. Less than 1/3 of current college admissions are men. Less than 1/3 go on to graduate education. You know, most mass shooters are men. I mean, so I feel like being able to relate, inspire, and empathize and touch young men is such a important thing that our society needs. And it's just warming to hear that. Like, almost brought a tear to my eye just hearing, like, thanks, Mom.
At the time, I'm like, are you calling me old? No, and I wasn't that much older than them, and it wasn't anything, I mean, I don't know.
But you had an impact.
Yeah.
Right?
I still hear from them, and that makes me know that I did.
And how nice is it to know that you had an impact? I mean, that's all no amount of money, I think, can replace that.
No, absolutely not. Absolutely not. So, yeah. But now I'm happy to be here. Not to segue back, but
no. I'm so excited for what happens next for you in this clinic. Already your panel is exploding. You're helping bring people into the practice, telling them what it's about, interacting on the app, and leading some of these meetings, developing our fitness and exercise curriculum. These are such critical parts of becoming an exceptional sort of wellness, health and wellness company. And just the people, the people who've already worked with you who just love you.
no.
I just had somebody who said, I want to work with Alice, longtime patient of mine. So, he's just here in the office, and, he's starting a new exercise program. And he's like, well, what do you think? Do you think Alice can help me out? And I was like, yeah, absolutely. So I know people are excited to work with you as a health coach and as a personal trainer. And I'm excited and honored that, you're here, and hopefully I know we're going to do great things together. I just know it.
I agree. Thank you.
So where can people find you? So how do people find you? Let's say they want to interact with you. Where's the best way to get in touch with Alice Smith?
Well, I'm trying to up my Twitter game. So you can follow me on Twitter, AMKSmith12. Other than that, if you text the office and do @Alice, you can get a hold of me. I think
there's this app called the Dr. Tro app.
Oh yes, the Dr. Tro app. Download it wherever you can download your apps for your phone, Google Play or the Apple Store, and you can find me there.
Yeah, and Alice, right? We should probably harp on that. This is how poor we are at marketing. We don't even, Anyway, guys, it's been an absolute pleasure. Alice Smith, it's been awesome to work with you. It's been an honor to work with you, meet your family, hear your story, hear their story. And all I can say is thank you. Already my patients are thanking you. Our patients are thanking you. And I can't wait to see what happens next.
Let's do it. Awesome. Thank you.